Brushfield spots are small white or greyish spots in the iris, the coloured part of the eye. They are named after the English physician, Thomas Brushfield, who first described them in 1924. The spots appear as slightly raised dots, like tiny grains of sand sprinkled on the surface of the iris. These spots result from increased deposits of a structural protein called collagen within the iris tissue. The arrangement of collagen fibers in the iris is altered, leading to the visible appearance of these spots. Brushfield spots are present from birth and tend to be more noticeable in individuals with lighter-colored eyes. The etiology of Brushfield spots is closely linked with genetic factors. The genetic basis for the development of Brushfield spots lies in the overexpression of certain genes on chromosome 21. These genetic anomalies lead to the distinctive morphologic changes in the iris that manifest as Brushfield spots. However, it's crucial to understand that not all individuals with Down syndrome will have these spots, and their presence is not exclusive to this condition. While strongly associated with Down syndrome, Brushfield spots can occasionally be observed in individuals without the condition. In such cases, their presence may be attributed to genetic variations that are benign and have no clinical significance. Nevertheless, their occurrence in the general population is relatively rare compared to those with Down syndrome. Diagnosing Brushfield spots typically involves a simple eye examination by a healthcare professional. It's often done during routine checkups, especially for newborns and infants. While Brushfield spots themselves are harmless and don't affect vision, their presence can prompt further investigation for Down syndrome if other signs and symptoms are present. The presence of Brushfield spots doesn't directly cause any health problems. However, individuals with Down syndrome, in which Brushfield spots are more common, may have an increased risk of certain health conditions, such as heart defects, hearing loss, and thyroid issues. While Brushfield spots are a physical characteristic, it's crucial to address the psychological and social aspects associated with their connection to Down syndrome. Families of individuals with Down syndrome may benefit from genetic counseling and support groups to understand the condition better and access appropriate resources. A holistic care approach is paramount for individuals with Down syndrome, focusing on their physical, intellectual, and emotional well-being. This includes early intervention programs, speech and language therapy, occupational therapy, and inclusive educational opportunities to help them thrive and reach their full potential.